I always tell people, I work for the best university in the world, 300 miles away. And you know, the nice thing about out here is, you know, if you turn the radio on Saturdays, you know, the Wolfpack's on the radio. You know, there's a lot of people here with those Reno ties. And I think the most exciting thing to me is you and ours, you know, well, University of Nevada started just down the road. I mean, that's the bell's still there. That was that first University of Nevada for a couple of years. So it's coming home a little bit. So this is my favorite memory. We had, I think, digital cell phones had just come to be. And all of the faculty, we had 2 solid vans full of people, and they're all looking at their cell phones and doing all this. And I had this big suitcase with a cell phone in it. I mean, it was just, and I hated the cell phone, and I'll tell you another story too. So anyway, so we're getting ready, and I said, I don't know what you're worried about the cell phones, because as soon as we drive past Fernley, they don't work. No. And to watch those folks, you know, who, all these physicians, all of a sudden, you know, their cell phones were cut off. So that was their entrance into rural Nevada. We also, one of my favorite memories was, you know, when you talk about healthcare in Nevada. I remember I've driven a lot around the state and gone to a lot of places and been on a lot of accidents. And, you know, you're always grateful for the EMTs and the highway patrol. And I've always thought, man, I work for a medical school. Wouldn't it be great, you know, to just have a physician with me, you know, and to be able to respond. And so we were driving, and we were just outside of Lovelock, coming this way, and there was a car accident. And I thought, man, I am loaded today. I had 2 vanfuls of physicians, and I'm thinking, wow, we're gonna hit it today. So I started pulling over, and the first thing I hear in the back, you're gonna pull over? And, you know, and what I didn't think about was, you know, so I had, you know, the department chairman for pediatrics, and I had this guy, you know, and they're all in the back. But that's not the kind of medicine they practice, you know. Those patients are handed to them. So we got out. We had a vascular surgeon from Las Vegas at the time, and she got out, and it was so great because they were all kind of tentative because there's no emergency room around, there's no sterile environment, and all of a sudden this car pulls over and this person jumps out and says, "Don't worry, I'm an EMT," and the seas parted, and this EMT jumped right in there and started doing the kind of medicine that they have to do all the time, you know, to get those people to Reno, you know, or to Las Vegas, or to wherever they were practicing. And then they take over and do all the hard stuff, but keeping them alive and doing all that stuff. And I remember we pulled into Lovelock to meet with the physicians and nurses there, and that's where that patient came to. And everything was fine, you know, and it was just, you know, it was just a really eye-opening experience to me about the different levels of healthcare that we have to have. I mean, we need those specialists, we need those primary care docs, we need those super subspecialists in this state, because our healthcare is so spread out, you know, transport nurses and paramedics and all those types of things. And so that's one of my fun memories. I'm sold on UNR Med. I went to school to go into public health. Never thought I'd go to work for a medical school. The only reason I did was the salary when they started, and I thought, you know, 2 years I'll do this and move on. But I really, you know, medical education and the process of all of that stuff is just something I really enjoy. It's you know, rural healthcare. That's my passion.